to the wall, about 12 inches away from the wall, and gently place the back of their hand against the wall so their hand will also be about 1 foot in front of them. This can help them walk in a straight line and be out of the main traffic flows in corridors or in a room. They may use the upper hand and forearm protective technique at the same time. The next area I want to discuss with you is called orientation skills. Orientation means knowing where we are in space at all times. This means we will want our patients to know the location of the dining room, the nurse's station, the beauty parlor, and other important areas from their living area or room. Knowing where different locations are improves their independence, can also enhance their self-esteem. To help them understand how to determine where these areas are, we have a couple of strategies we use to assist them. The first to use is what we call landmarks. A landmark, by our definition, is any familiar object, sound, odor, or temperature that has a permanent location in the environment and is easily always recognized. Some examples of landmarks will be the nurse's station, a fire extinguisher wall box, a drinking fountain, a buffet table, a piano, or things of that nature. These are places that will help your patient determine where they are in relation to other places in your facility. We also use clues. A clue is any sound, odor, temperature, or tactile stimulus affecting the senses that can be readily converted in determining their position, but it will not be permanent or always available. Examples of clues are smells coming from a beauty parlor, or sounds from a television set, or sounds or voices in a busy dining area. Clues are less reliable because they're not always present. The next thing I want to discuss with you is travel with a white cane. White canes have white and red pieces of reflective tape on them that shines when light hits the tape. The tape helps mostly outside when a blind or visually impaired person is walking at night. This refers to a cane used for mobility, not a support cane, which persons use for assistance when they have difficulties in walking. A person with vision impairment or blindness who uses the white cane or long cane has been taught by certified teachers like myself on how to use them. You must not attempt to work with patients on how to use this type of cane. If you notice a patient with a long cane having difficulties, pass this information on to your supervisor so they can contact any of the agencies listed at the end of the video. A certified teacher then can work with that patient on any difficulty they may be having in using their cane. The next area to discuss is glare and contrast. Bright light can be very uncomfortable for some patients with eye conditions. You can always ask your patients, do you prefer sitting with your back to the window? Or do you prefer to have the lamp moved to a different spot? Or how do you like your curtains set? Glare can also cause them to see less well. It is usually best to have light from floor lamps or table lamps come from behind the patient and over either shoulder. This way the glare from the surface of their reading material or the table will be reflected away from their eyes. Contrast is a very important thing to think about. Some patients will have difficulty seeing black coffee in a dark cup or a white-colored plate on a white tablecloth. You can help with this in many ways. You can try to make sure that objects they will be using are of a different contrast for the table or counter activities. Dark tablecloths will help with white dishes. White tablecloths will help with dark dishes. White paper on a table can help with arts and crafts objects that are colorful. Let's talk about environmental precautions. There are some things we can all think about to make the environment safer for our patients with visual impairments and blindness. First of all, we need to be careful with throw rugs. While they look nice, they move on occasion and can cause falls. Make sure electrical cords are behind furniture. Extension cords are handy things to use, but they can cause tripping. Make sure extension cords also remain behind furniture and away from areas where patients will be walking. Shiny wax floors look very nice, but they are also slippery surfaces. Try and use low luster waxes whenever possible. And remember not to leave cabinet or closet doors or drawers partially open. Your patients can walk into them. And make sure to push in chairs at a table or desk when not in use. It's been a pleasure for Jennifer and I to be here today to discuss blind rehab techniques and specific eye conditions that you may encounter with your patients in your facilities. If you have any questions, feel free to contact any of the resources listed at the end of the video, and we wish you all good luck in your careers and working with individuals with special health needs.